Could I call upon Dr. Vaidya, please, on stage? Because we are starting our next panel on mental health. Okay, one thing I would like to say, if the parents and teachers or therapists have any questions they would really like to ask the panelists, please write it on a paper and give it to me. If time is feasible, I would definitely discuss it. Okay, so you could write it on a paper. I'm Dr. Sarmishtha Chakrabarti, one of the consultant psychiatrists. And I think in the last 2 days, you've already met Dr. Gauri Divan, who is a developmental pediatrician. She is the CEO of Sangat. And Dr. J.R. Ram, who is the co-founder of Mental Health Foundation. So it's really interesting that about a year back, in a small room, a few people, 3 or 4, okay, Dr. Vaidya is here, who has his own center in Kerala and giving quite fulfill and good treatment of autism with Ayurveda. So, yes, so 1 year back, in a small room with 3 people or 4 people, we just started this discussion about India Autism Center. We didn't have a name then, and Mr. Somani had this amount of energy, and we were just thinking it's impossible or it's very far-fetched and it's a dream. But today it really feels that it's going to be true. And thank you so much, all of you, who've really made it possible, and we can think ahead from now. The brainstorming which happened in the last 2 days, what came out is that autism has increased exponentially over the last decade, all over the world, because we have speakers from all over the world, and in India as well. It's alarming how many children we see these days, and with the research which is going on and the new tools and apps which are coming up, I think we can be sure in the next few years, it's going to be really, if not reversal of the behavioral symptoms, we can come up with new ideas to actually treat a lot of problematic behaviors of autism. Now, what we also learned is that there are therapists working on it, there are teachers working on it, parents working on it, there are alternative medicine as well as medicine who are working on this. So today, how important is mental health? It's about, as we learned yesterday from Dr. Ram, that it's about 5 times common in autism than the general public. So I would like to ask Dr. Ram to speak a little bit about how common it is these days that autistic children show mental health problems.
Yeah. Good morning, everyone. I think essentially, autism as such is a complex problem, and personally, why I started wondering about the mental illness part is after we made some errors in judgment, we missed some diagnosis, and actually a young girl, she killed herself. And then, in all these situations, the therapists, the parents were absolutely doing what they were supposed to do. And we were not being able to make progress. So that was about 10 or 12 years ago when I started looking into this area and realized that it has always been there, that the prevalence of mental illness in autism spectrum disorders is a lot more common. But because of the complexity of autism itself, the mental illness part gets camouflaged. And again, many of the children are non-verbal, many of us are focused on addressing the immediate needs, and we often lose sight of the longitudinal progress of the child with respect to behavior. Mm, that are there mood fluctuations, are there abnormal behaviors like mumbling, talking to self, because many of the symptoms of mental illness are subsumed under symptoms of autism. So therefore it becomes a difficult judgment. And I'm not saying that it is easy, or some of us are more able to do it, but I think the whole point of my presentation was that we need to keep this in mind so that we don't miss it.
Yes, and that is important because it's pretty common. So, when a child comes to your clinic, Dr. Divan, what are the first signs and symptoms you would look out for when you refer to a psychiatrist?
So we're talking for mental health problems within the
Yes.
autism spectrum. So I think really, as a developmental pediatrician, all of us, and I think all of us who work in this field, um, it's always important to listen to the parent. So I think when parents flag up changed behaviors, they flag up worries, we should really be listening. I think part of, I don't know if there are any general pediatricians here because there are very few developmental pediatricians. The thing is, the level of awareness and the time that pediatricians have is usually very short. And mostly parents will go into a clinic to really talk about immunization or something else that's happening in the life of the child. And then will also say, oh, by the way, my child is not speaking or my child is playing in an awkward way. So I think that general awareness amongst all paraprofessionals in some ways, and all professionals really needs to be upped. So whether you're a dentist who deals with kids, or whether you're a pediatrician, so all of us need really a greater awareness of delays and disabilities. So I'm not really focusing on autism itself, I'm just talking about all delays and disabilities. As a developmental pediatrician or as a pediatrician who is managing a young person with autism, it would really be important to think about any change in behavior. So if you have a mother who says, look, he had some repetitive behaviors, but now it's just he's not doing anything else, that's a significant change. And there should be some awareness that could this be OCD. So there is this really fine line between repetitive and restricted interests and OCDs. So these are the kind of changes in behaviors which I think Jai has also referred to, which is really critical, which we should be listening for.
And I think what is, yes.
I think Gauri hit the nail on the head really when she said that it is, see, parents know a pattern of their child and they are doing the therapy, they are doing whatever they are being told. If anything changes from there, we need to listen to the mother and listen very carefully to realize that something more is happening. This is not usual behavior for the child. And I think that is the linchpin really in being aware about mental illness.
And can I just add something? Sorry, we're taking away from you. But I think the other thing is also to be very careful who you refer to. So I think there are very few people who understand child psychiatry. I think this is a complexity across the country, but it's also across the world, is that we don't have enough people who understand child psychiatry, probably even less child psychiatrists who understand autism. So within that smaller and smaller shrinking group, to understand people who really understand how medications work within autism is also really very important. So I would really be concerned, as a group in Calcutta, to kind of have a referral list. So, if this center is really, keen on having a referral list, that would be useful, because I think you need to refer to the right people, because most psychiatrists, I hate to say, are very keen on polypharmacy. Families will come out with 10 drugs on the list. We don't know what any of them do to a brain which is neuroatypical. So I think these are really important concerns going forwards, as a community in Calcutta.
Thank you. Yes, 2 points have been flagged out here. One is that the awareness bit, that, most of the people are not aware, especially if you consider the villages, and the uneducated population, they are much less aware. Even educated people, they're not really aware of autism, or they're in denial, really. But that's what is important, is early intervention. So if there is a query, and if the developmental pediatrician is worried, of course, then a diagnosis needs to be made. Dr. Vaidya, you talked about early intervention as well yesterday. And how often or do you see children who are really, really young, like 2 years and 3 years? And what is done in Ayurveda?
Yeah, that's a good question because see, the general tendency in our public in India and outside India is to resort to alternative therapies when all the conventional methods fail, obviously. So initially, say maybe in 2002, when I met the first autistic child coming to our treatment, she was 10 years old, and they came from US. So there was no tools at all to address their problems. But I think these days the picture has changed completely. Now even we have kids come soon after their diagnosis, maybe 2 years or 2.5, like that. So the picture is changing, obviously. So we get kids for early intervention these days.
Okay, thank you. And of course, you talked about some myths, because, there are many myths about Ayurveda, and not many people know a lot about Ayurveda. And there are a lot of questions which arise that, the medicines which are used in Ayurveda from natural products, do they have lead, or do they have any other minerals which could be really harmful? Because you talked about the gut cleansing, isn't it, and the detoxification. So could you elaborate on how to get rid of those myths, and so that people can be aware that this treatment can also be tried and it works?
So thank you for that question. There are multiple facets for that question. I will try to answer one after the other as quickly as possible. The myths about Ayurveda, number one is that Ayurveda is a herbal medicine. So this is very clear from most of the mails which we receive. I have a kid who is autistic or diagnosed with autism. He's 12 years old. Can you please send some medicines for him? So they expect I prescribe some ashwagandha or brahmi ghrida or something like that, and dispense them all through the courier, or they start curing their child. That is number one. So it is not. It is not a herbal medicine. As I told in my presentation, it's a whole system of medicine which has got its A to Z in the intervention. From the very point of diagnosis, evaluation, explaining the pathology, pathophysiology, then the pharmacy part, everything, it has got its own methodology. Of course, mixing up is very frequent these days. Number two is, it's a religious ritual. Many a times, Ayurveda is regarded as there will be some chanting of mantras or something. It's something related with the Hinduism or something like that. Again, which is not. It has nothing to do with religion, mantra, or Hinduism. It originated in India, so obviously at that time, maybe 5,000 years ago or so, it will have its social and cultural components remaining in it. So we seems to be or appears to be like that, number two. Number three is how toxic the medicines are. Is there lead in it? Is there some heavy metals? All these things. I would say yes. I would say no. Yes, because we use plenty of metals in our medicines. Like say we use gold, we use mercury, sometimes oh my God, mercury is medicine. Okay, we use mercury, we use this arsenic. All these things are medicines, but they are properly processed. And those Vaidyas who use mercury or arsenic should not depend on the market to source their medicines. They should be making it. And interestingly, Ayurvedic people are the rare species where they have got the entire right to make their own medicines. Sometimes you may not be able to make paracetamol for your patient, but we can make medicines for our patients. So when the medicines are made perfectly, they are safe, and many studies have seen that they are safe in all sense. But commercial medicines, there were big waves of allegations in US and UK that beware of using alternative systems of medicine, especially Ayurveda, they may contain heavy metals. That was a big issue at that time. Then on the other side, I would say no, because see, toxins are not added to the medicines deliberately. Say in Indian context especially, if your vegetable contains lead, if your rice contains lead, your herbal medicine also may be contained. It is part and parcel of the soil, the water, and all these things in India. So they are never deliberately added as in the pharmacy as medicines.
Okay, thank you. And a question actually came from a clinical psychologist for Dr. Ram. What will be the management? This is, I think, a hardcore kind of mental health issue which most of the parents face a lot. What will be the management of a child, adolescent, or adult who has suffered a phase about a year with tremendous self-injurious behavior, biting themselves, biting self when comes to a compulsive behavior, also biting their own hands? Is there a link with OCD? And what categories of medicine generally work here? So there are many, many questions in that one question.
This could be a PhD thesis, really. I will answer it. See, um, essentially, suppose I see a child who is presenting 10 or 15-year-old with self-injurious behavior. Now, the reasons could be many. Before we jump into the conclusion that this child's need medicine for self-injurious behavior, the first thing which I would like to know is, how is there, again, as Gauri said, that is there a change in the behavior? Is it something which is new onset? Is the child injuring himself, biting himself, which is a recent onset? And in my experience, in my team's experience, self-injurious behavior arises primarily due to many reasons, of which initially it could be boredom, because the child is not getting enough stimulation. So we need to look into the environment. What are the changes? Has the mother kind of had another child, so she's not able to spend time? Has the school changed where the child is being left on his own devices? So first we'll look into the environment to figure out, is there a change in the environment for which the child is self-stimulating. The second thing could be, many children, as I have personally realized, that I personally am extremely poor in understanding the sensory processing disorder. So is there happening something on that front? And is there a sensory processing issue which needs to be looked into because the child is biting and getting some stimulation from that? Is it something OCD? Are there other features of OCD in the child which is new onset? So I wouldn't jump into a conclusion that the biting behavior is compulsion if there are no other OCD symptoms in the spectrum. Um, what else? This is a difficult question, really. So gradually, I think that we need to work as detectives, trying to figure out fit the various pieces, and I won't jump into any medicine per se, but there is some literature about serotonin reuptake inhibitors, risperidone, we have to be very, very cautious, as Gauri said, before using medicines, and it has to be very well justified that we have excluded other causes and we are trying medicines.
Yes, and of course, medicine has to be very low dose and slow, and, environmental factors has also to be considered.
To be honest, in my experience, in majority of the situations, we have been able to figure out something in the environment.
Absolutely.
And the child
Absolutely.
also has recent onset of rocking behavior, hitting, injury. So 95% situations we have been able to figure out the self-injurious behavior is because of something in the environment rather than a new onset mental illness.
True. Dr. Divan, I mean, what do you think? Like, temper tantrums, biting, these things are, many children kind of come up with that. So, in autism, do many patients come up with it to you? And in that case, what do you do? I mean, do you manage with therapies, or would you actually refer to a child psychiatrist?
Yeah, so I think, the core impairment in autism is really social communication. And so the interventions that we work with are really looking at the communication impairment as the fundamental difficulty that young people with autism have. And I think, very much as Jay has just said, is that it's really about understanding what is this child trying to communicate to you through these behaviors. Is it a transition period in this child's life? Is it a sensory issue? Is it a issue of an environment which is either hypersensitive, hyper exciting this child, or is it an environment that is too boring for the child? So I think this issue around behaviors really being fundamentally about something that's happening in the child, and the child cannot communicate this to the world around them, is really the way that we work with our kids. So
Yes.
really looking at it as a core social communication issue and building on that.
Yes, and Dr. Vaidya, one of the things I was just wondering, how do you treat these behavioral issues with Ayurveda? Do you have any thoughts or?
Yeah, actually, we do not have a program for that at present. So we try to incorporate as many expertise as available regarding the other aspects, like the behavioral training or special education or whatever it is. And we are very open. We never offer anything other than this Ayurvedic therapeutic part. And the reason is very simple, which I expressed yesterday. You go for anything which you seems to be beneficial, but do it on a calm body, a calm environment, and we can help you to make your system, make the system of the child better, more pure, non-toxic. So the output can be better. As of now, we do not have any other tool for that. And I would like to just add one point, especially when Dr. Ram was mentioning about polypharmacy. As far as Ayurvedic treatments are concerned or medicines are concerned, we have observed that those kids who are on special molecule, the risperidone, it's very difficult to respond to our medicines. So it is very difficult to mix up also. So they may not be able to withdraw, they may be adding on Ayurvedic medicine, but they will end up in desperation. So polypharmacy is to be considered very
Very
seriously, whether
carefully
it is
and
a good thing or
seriously.
bad.
You're right. And, when we see a list of 5 or 6 medication on a little child of 5 or 6, it feels really terrible. So, one of the things is that yes,
Can I
Dr.
just,
Ram.
I know I have said this on numerous occasions, and people just scoff when I say this. Uh, when children are put on medication, I think parents need to ask why. Uh, and there has been this long running debate that, you doctors are so arrogant, you don't answer our questions, but you need to ask why. So, why would my child be put on 5 or 6 medicines? And unless you ask, I won't say, because I'm quite happy with my fees and I want you to go out of the door and see the next patient. So, you need to ask, and this is something I keep on saying, but rarely happens.
Yes. Um,
And to that,
one
sorry.
of the, yes, you can.
So I just want to say, so this is really very interesting, but I think there's such a differential knowledge and such a differential hierarchy of who a doctor is and who a patient is. So I think, you're really approachable and you're wonderful and I can sit and kid with you, but I don't think most doctors are like that. And so again, coming to Calcutta for this particular center, if there is one thing, one of the many things that you want to do, I would say really empower parents. And that should really be a fundamental building block of giving parents the tools to question. I think that's really very important.
Yes, the awareness and the parents to be given the power to ask questions, of course. And one of the question has come from, I think, a parent, Mr. Debashish Mondol, who asked Dr. Vaidya, I think Dr. Vaidya, yesterday you spoke about that there can be external treatment like therapies and medication, but you have to have a pure uh, internal system. So, and gut is very important is that, and what he asks is that, what type of diet should we give to my autistic child at home that increases the gut flora and detoxify heavy metals from the body?
Okay, I think I will not have a ready-made answer for that because we need lot of customization or personalization for that answer. But by and large, we use something like a modified gluten-free, casein-free diet, and we encourage the parents to stick on to the traditional diet which they follow for generations if it is practicable, the traditional stuffs, the traditional way of cooking, and the traditional recipes. And again, to observe the child, what we have noticed is that something which may appear to be very safe to the public or the normal kids, if a child shows some sort of a craving for a stuff, we should make out that it is intoxicating the child to some extent and keep a very close eye on it and try withdrawing it slowly, and that itself may calm the child down.
Okay,
So
thank
there
you.
should be a
Yeah,
keen observation. What is happening with what?
absolutely.
And that will bring about a lot of information regarding the diet.
Yes, and observation by the
Yes,
parents and the carers
yes.
are most important according to the
I
discussion we
know
had
kids with
today.
one chapati, child bubbling for 4 days.
Yes, right. Okay. One of the things is that, when does the parent understand, Dr. Ram, that the child has become really mentally ill, that is psychotic or severe anxiety disorder? When would the parent understand that? What are the symptoms you're looking at?
Again, there are, see, anxiety disorder is pretty common, and I think we miss it, particularly in adolescents and those who are, our clinical experience, says that from 7, 8, 9 onwards, children who are high functioning, we are better at picking up anxiety disorders in them for many reasons. So, again, any new onset, and often they quite explain it in some language they have, that they are feeling anxious, their behavior indicates that they are anxious, so they would be wary of going to school. There would be other things, behavioral indicators that this child is avoiding something, avoiding situations. So, and often many children can tell you that we are in their own way, they can communicate that they are feeling anxious. Psychosis is more complex, and to be honest, I have learned with patients and children and parents that uh, I don't know whether I'm the only one, but I have learned from Dr. Satish Girimaji, who was my teacher in NIMHANS, and he really introduced this concept of bipolar mood disorder in children with autism and adolescents with autism. And I feel again there are, you know, peaks and highs and lows, and mothers would tell you that he has become absolutely quiet, refusing food, and then there would be periods when they are eating more sociable, so that kind of pattern. Uh, Psychotic illness, again, new onset of bizarre behavior, soiling, marked regression. So a 14 or a 15-year-old child was doing a lot of things. Suddenly there is marked regression. I would think of psychosis. Overall, I wouldn't even dare to claim that it's an easy area. My only thing is that, we need to be conscious of it.
Correct. So we have less than 30 seconds left. So I would like to ask Dr. Gauri, please, in a line, could you tell us what experiences did you have in the last 2 days, and what are the important points you would like to tell us, which you got from the last 2 days?
Okay, that's unfair to have me say this in one line. But generally, I think it's been a very rewarding. I think particularly the parents are tremendously engaged and really looking for answers in many ways. And I think it would be really up to the organizers and the center to really think about a very structured way forward which could support families and their children to really look, okay, that's right. What are the best pathways ahead? So that's really what I would say. But and also to say thank you very much for the invite.
And the same question to Dr. Ram.
No, I think I'm very, very impressed with the energy, and everyone's energy, the organizers, the participants, the people who have traveled so far to enrich all of us. So again, a big thank you, and it has been a hugely energizing experience personally for me.
And Dr. Vaidya.
I think the greater minds should come further closer and add some soul to it. Thank you.
Yes, thank you so much. I think a few points from my end would be awareness is being spread more so with these kind of programs. The parents has to be empowered so that they could actually come up with the problems, and we need to have a multidisciplinary approach, and all of us have to come together, and India Autism Center is enabling that. Thank you so much.